Welcome everyone. We're at the VEITHsymposium 2019 in New York, and my name is Steve Elias. I'm the director of the Center for Vein Disease at Englewood Hospital in New Jersey, and I'm with Mr. Stephen Black. Remember, he's from the UK, and they call the surgeons Mr. Stephen Black from Guy's and St. Thomas's Hospital in London. And what I'd like to talk to you about today is, Steve, is venous education. First, I want to ask you, do you find that there's a segmental type of venous education between the US style and the European style? Are there more differences and similarities, or is more similarities and differences?
I think, it's a good question. I think there's probably a lot more similarities in the absence of proper education, which we're all trying to address. And I think the fundamental problem is a lot of that sort of perception of arterial surgery-based practitioners is that veins are easy and they can just do it and they don't really have to do much about it because nothing much can go wrong. So all the complexity of venous disease is lost in training, and it takes an individual with passion to go and find out about it, to go and educate themselves. So I think those are similarities. From a differences point of view, I think you guys have really established some very strong structure to your venous education programs here through the AVS, the AVF, and some of the stuff that you guys do in New York, particularly at your center with the expert vein management type of setup.
Right. So let me ask you about, sometimes when, you've been to meetings in the US, I've been to meetings in Europe and around the world as well as you have. It seems to me the attendees have a different way they interact with faculty. There's a little more, in my mind at least, and explain if I'm wrong, a little more of a reticence outside of the US for people to engage as much as in the US. In the US, at most meetings, people are on each other, so to speak.
Yeah.
And Europe, they're a little more reserved.
Well, I think in the US, everybody engages in debate. I think what we have to remember with Europe is a language issue a lot of the time. So most people are speaking a second language. And there is a much more deferential, hierarchical approach to what somebody would consider a professor or a teacher when you go to European meetings. So they don't want to challenge you. So a lot of the challenging happens in small group discussions rather than in a big open format. And in the US, people are quite comfortable challenging each other in a room full of people. And that's probably not the case in Europe.
Right. So let me ask you this. You've been to the expert venous management meeting that we hold in Englewood, and you've been faculty there, and you see that interaction. And we're going to be bringing it to your place, EVM UK. Do you think we need to change anything in terms of being able to engage the people? Because the meeting is really a real engagement of the attendees and faculty.
It is, but I think that's about the style of how we, as moderators of such a meeting, would engage everyone. So I think what you'll find when you come out and the style that you approach, and Nikos and Tony, your partners, they're very engaging with the participants. That then allows people to feel comfortable, and that comfort allows people to talk freely about what's bothering them. And that sometimes is lacking in some of the structure that we set up with meetings in Europe. You've been to the European Venous Forum hands-on workshop,
right.
And we get much more discourse going there, but you need to warm everybody up over a period of time.
Yeah, and I agree. It's part of our job to do that. I want to switch gears a little bit in terms of education, because many of us in the US get our education about new devices and new products from experience that the Europeans have. For whatever reason, it's easier to begin and get new stuff in Europe versus the US. Have you found that to be a problem, meaning you guys start doing stuff much sooner and then we kind of have to wait because the FDA and whatever is not going to let us do it? Sometimes that works to our advantage because you've gone through the learning curve and we don't need to go through that. Have you ever said to yourself, I wish we weren't the first people doing this? Because
it's a double-edged sword, isn't it? Because the fact that we get things first has given us an advantage, and actually that's going away now. You've seen devices like Inari have not come to Europe first. They've gone through a 510K approval process in the US and got out here much before they get CE marking, which was really tightened up.
That's true.
And we have no idea what the impact of Brexit is going to be on a CE marking process and how that's going to change things. So the advantage that I've had in my career is by getting things first, you're at the front of that wedge as you drive change. So that's a great place to be. It does come down with the downside that you have to be very careful how you do that, and that's why we spend a lot of time as a group of interested clinicians talking to each other about the challenges we face. You don't do it in isolation. You do it with your friends and colleagues.
And finally, let's kind of just to sum it up here. If you were the world's leader on venous education and you would get everybody in one room together that's educating other people, give me one or two things that you would say to them, guys, this is what we need to accomplish on a global scale.
Yeah. Okay, so I think the most important thing is appropriateness of care for patients. We need to get people making considered, appropriate decisions for treating patients that don't involve a reckless attempt to just use product because it's available. So I think understanding appropriateness is the key thing. The second would be to understand that we as clinicians, by what we do to patients, control virtually all the outcomes. Most of the products we use nowadays are pretty good. Most of them achieve a result. The failure is not the product most of the time, it's how we've used it. So that it's not about blaming the other stuff. We have the control of what the outcomes of our patients are going to be. So appropriateness, and take control of yourself and accept that responsibility to make the patients better. Okay, so I think that was a very good speech as you wanted to become now. I said you're going to be the world's leader, the first world's leader in venous education, Mr. Stephen Black. Thank you, Steve.
Thank you. And we're glad you all listened. Thank you.
Thank you.